But virtual conversations with Kate, it just kind of our goals and our missions of both of our programs, her insight, her intellect.
Yeah, so Kate has definitely set us up for success. I would say I'm holding on to Kate as tightly as I can.
I think one of her main traits is, again, that kind of inclusivity or openness to understanding what, number one, understanding that there is a difference in this culture, this healthcare professional culture that exists. And number two, I think she's definitely learned a lot by the work that she's been doing with the healthcare professionals.
But one of the most poignant impressions that she left on our students was her capacity to really talk about disparities and ethical and equity issues in such a way that didn't really other populations or themselves, So how as a provider, sometimes it's like, well, that affects our, who we serve, not necessarily an all-encompassing approach. And then using a lot of key terminology, most of my students, the rhetoric has been out there for a long time, the key words, the hot topics, but no one really goes into the identity of who we're serving and why we need the team to serve the people that we do. And so her approach and her lens in understanding that it's not just reacting to things, that there's actually a system at play and how we can become more involved in this system to really start making changes, I think left my students invigorated on a Saturday morning. They were completely engaged. And I think our reflections about the conversations that they had in that space really brought home the bigger picture of what we're saying. So it's not just, the Colorado community. This is just something that, an isolated that your director is trying to drill into you. It's like now fostering a real community of providers that are like, no, here are some ways to have conversations. Here are some ways to build our team. This is how you find yourself. And I think her way of seeing people, not just the group, not just the forest, but she saw the trees, and I think that of all the facilitators that we've had, that has been probably the more personal feedback points that the majority of which really kind of shared, and that was phenomenal.
I think for me, the most surprising, honestly, is finding a consultant who genuinely understands the needs of the business and genuinely is able to provide a solution that really aligns with the culture and business objectives, and isn't necessarily doing something off the shelf or doing something that's cookie cutter. They're sort of really customizing to our needs. And so our goal back then was to figure out how do we create a more consistent program or consistent offerings that would work with different types of audiences. And proud to say that 3 years later, there's a lot of overlap, still opportunity, but there's a lot of consistency in terms of what we teach. We adapt it to the audience, but not so much that you wouldn't recognize it if you were in a student program versus a practicing clinician program versus an academic setting program, which was a huge sort of endeavor, and Kate was definitely integral in that process.
I would say the experience was absolutely inspiring. From one professional to another, I felt absolutely inspired, equipped to move forward with my own vision of what I wanted to see produced in this program, and working with someone with such a high level of professionalism and high level of communication skills was absolutely fantastic.